Good afternoon, everyone. My name is Ainslie Monson and welcome to the lecture for today. Today we're going to be talking about ethical considerations for the registered nurse. I'd like to begin by the learning objectives for the session. So today, hopefully by the end of the lecture, you'll be able to identify the ethical principles in healthcare. We're going to discuss the ethical dilemmas faced by undergraduate nurses, and then we're going to discuss the strategies to resolve some ethical dilemmas in your daily nursing practice. So ethics and your nursing career. So you've chosen a profession that is well respected with the belief that you're caring, kind, respectful and want to help others. And this is pretty much the same impression that the community sees nurses as well. So along with learning your theory relating to your clinical skills, you also need to learn about ethics, as ethics is the basis and vital for delivering safe and competent care to your patients. So throughout your nursing career and also while you're an undergraduate in your clinical placements, you're going to come across some ethical dilemmas in your workplace. So we're going to give you some examples of those and see how we're going to work through them. But before we begin, let's talk about what guides you, what keeps you safe, and some guidelines to help you adhere to and work when you're working as a student nurse or a registered nurse. So upon registration, you're bound by the Nursing and Midwifery Board of Australia, who is responsible for regulation of the nursing and midwifery profession. And during your clinical placements and on registration, you will be required to make a commitment to uphold these values. You're going to work in collaboration with other health professionals, patients and family members effectively, and you need to do that ethically as well. However, you must remember that these codes do not eliminate moral dilemmas and you need to act morally. I've also given you a handout about the extra ethical theories that we're not going to discuss today. Also some links to the Nursing and Midwifery Board so you can go through these guidelines and standards that are there. And I've also listed some articles of interest for you here to further your knowledge base in regards to this topic. And on the back we've got a notes page, so while I'm discussing this topic you can take down some notes. So within the Nursing and Midwifery Board of Australia, they have set out some professional standards. So we've got the Code of Ethics, Code of Professional Conduct and the Registered Nurse Standards for Practice. We've got some guidelines in there for continuing professional development to help you develop professionally and some things that you need to do when you're working. And we've got also frameworks which assess standards for practice for registered nurses, enrolled nurses and midwives. So what is ethics? What is your understanding of ethics? Does anyone have any question, any feedback they can give me on what they think ethics is? Okay, so it's the branch of a philosophy or study, and it can be used interchangeably with the word or term morale. And ethics is important because it sets forth a series of actions and decisions that are in the best interest of the patients. And it's a moral compass that pushes nurses to administer services fairly and in a timely manner. As you can see on the slide there, we've got a definition of ethics, which you can read yourselves. And as we know, ethics is normally learnt from childhood, growing up, from your peers, school friends, family members during your lifetime. And they're what guides us in the choices we make in our professional life, and they also have a very big impact on how we deliver our nursing care. Now we're going to move on to some ethical theories, and as I've just mentioned, there's some extra theories in the handout that I've given you and some extra sites that you can go ahead and look for. So different theories exist and can be applied to different situations to inform our thinking and support our decision making. We've got 4 listed here, and I'm not going to speak to them all in this short introductory session, but we will discuss ethical principalism because it's the most popular theory used today when we're considering ethical issues in nursing and in healthcare. So ethical principalism is the view that ethical decision making and problem solving are best undertaken by appealing to sound moral principles. And we've got those principles listed there on the slide. So autonomy, respecting a person's right to make decisions when they're in hospital in regards to their care. Justice, so we aim to deliver fair and equal distribution of care to all, so not favouring one patient over another or one family over another. Beneficence, so our aim above all is to do good, to promote people's welfare and well-being of others. And the opposite to that is non-maleficence, above all, do no harm, avoid hurt. Also linked to this is the National Safety and Quality Health Service Standards, especially with non-maleficence, as the aim of the standards is to protect the public from harm and improve the quality of care. And we won't go into the National Safety and Quality Health Service Standards today because that can be for another discussion and another lecture. So how does all this ethics affect you? Always remember that you must be able to explain and be accountable for your decisions and actions when you're looking after your patients. So when you're out in your clinical placements or you're working as a registered nurse, you're going to have to frequently make decisions for which there's always not a quick or easy answer. You may be preparing and looking after your patient, and the doctor will come in and say, is your patient ready for discharge? So that's up to you then to go through all your paperwork, viewing your patient, looking at their observations to make sure that you think they're fit and ready for discharge and they've got the right placement things that they need in place to go home. You'll have to judge when you have to judge what is right or wrong. So you may be out in your clinical areas and you may witness some unprofessional behaviour. You need to determine if that's right or wrong behaviour, or you challenge your preceptor if you see something that your preceptor hasn't done correctly. So that's a bit of a difficult situation that you'll be in. Making a difficult choice, so when the patient doesn't know whether to continue treatment or not, so the patient will sit there and say, what would you do? And unfortunately, it's not about you and what decision you would make. You need to inform the patient of the positives and the negatives of the treatment and ensure them that's up to them to make that decision. And then finally deciding whether to do something or do nothing. So you're looking after your patient, for example, the patient's observations are all within range. They've taken their blood pressure and their pulse and their temperature and everything looks good, but just something inside of you get that gut feeling that something's not quite right. So do you act on what your gut feeling is saying, or do you go by your doing your observations? And this is something that you will be able to look into and be able to do as you progress through your nursing career and you get more confident and you develop your critical thinking skills. So what we're going to do now is watch a short video on ethical dilemmas in the workplace. So the first part of the video is going to show you some poor behaviour and some poor standards of a nurse looking after a patient. The video afterwards is going to demonstrate good behaviour, positive aspects of how you should look after your patient. And these are actually entwined with your guiding documents and your standards. So the video clearly demonstrates how your own moral and values can be affected due to the busy, fast-paced working environment that is going to affect your practice. Okay, so we want to teach you to uphold your values regardless of pressures for your own professional codes and conduct and adhere to patient safety. So I'm just going to play the video. And hopefully you can see that, because I can see it. So it's just a short 2-minute video. And just identify in the first one some things that the nurse probably could have done better.
She does not like how people pronounce my name. Oh well. Anyways, here's your pain medication. Your name, Mr. Olson, right? Alright, here we go. I dropped the medication. But you know what? It's alright. Let me just wipe this off really fast. 5-second rule, right? Scrub, scrub, scrub. You'll be alright. Anyways, I'm not a COD nurse like my twin Sonia. Alright, there you go. Well, we have a nurse nursing shortage, so I must run. Goodbye. Hi, Mr. Olson. I am Nurse Celia, Brown COD graduate, and I will be your nurse for today. I am here to give you your medication. Can you tell me your name, date of birth, and if you have any allergies? Okay, that matches your ID band. I am going to give you your medication now. Here is some water for you. There you go. I'll be back in a few minutes to check how the medication is working. Here is your call list. I will put the surveillance up. If you need anything, please don't hesitate to call me. Thank you.
Great. So what I would do now, I'll split the students up into some groups and have a discussion of identifying what the nurse could have done better in the first video, and then secondly, in the second video, point out some factors that she did well in that video. So now I'd like to ask all the students, what do you think are some ethical issues that you're going to face in your workplace or as student nurses? Okay, so we usually think of the big issues like end of life, quality of life, but we want you to start thinking about the smaller things as well. So it's about supporting patient choices, okay? Like we mentioned before, it's going to be difficult for you sometimes to think. You sometimes wonder why the patients are still continuing their treatment when you know that there's really no hope for those patients. Patient care, so prioritising your patient care, trying to get all your work done, and that sometimes causes a bit of turmoil within yourselves. Witnessing unprofessional behaviour of other staff to each other, or from patients to staff as well. So being in those situations and knowing what to do when you witness that behaviour. And also one thing that's quite serious and hard to intervene or report on as well is seeing incorrect or unsafe nursing by your peers, which you may see in your nursing career, or your preceptors doing that as well. So these are some ethical dilemmas and situations you're going to be in, but as you progress through your curriculum, you will learn some strategies to deal with these situations. So a couple of strategies that I think are important for you to go away with and to work on is to always adhere to your practice according to your professional standards, guidelines and frameworks, and always abide by, listen to your own ethics and values. Always put the needs of the patient first, accept their wishes and decisions. Always advocate for your patients, speak up, knowing their needs and wishes. And always reflect on the provision of care that you provide to your patients so you can learn from what you're doing and implement and put some better things in practice if you need to. And more importantly, as we were talking just before on the previous slide about seeing unprofessional or incorrect provision of care, is the moral courage. So the willing to speak up against unethical and unlawful or outdated wrong practices. And as I said, you will learn some strategies throughout your curriculum to do that. I'd like to end on a note with the famous nurse Florence Nightingale, who way back in 1858 has the same principles and ethical values in regards to nursing and providing safe care. As the very first requirement in a hospital is that it should do the sick no harm. So that ends the slideshow and the discussion. So what we're going to break off and do now is we're going to get you into a clinical scenario where you're going to act out, the patient's going to be in the bed. We're going to pretty much regurgitate or do what we did in the video. So we're going to have the nurse in the patient in the bed. The nurse is going to come in and do some a bit hit and miss care, not do the right checks, drop the medication on the floor, and then the patient then the witnesses can sit down and write down what the nurse has done wrong and what they have done well. So just to give you a bit of hands-on practice in regards to that. Hope you all enjoyed the video. Let's go and do the simulation. Thank you.